Week we're going to do we're going to talk some TMJ. So a lot of people don't realize that as chiropractors, if you've had the training, then you can actually treat a lot of cases with TMD cases or TMJ problems. TMJ is the temporomandibular joint. It's the joint right here in the jaw, and when there's problems in this area, the joint, the jaw is called disorders of that. So TMD, temporomandibular disorder. So in some cases, what the problem is the patient actually clenches a lot at night. So they might be grinding their teeth at night, and you can see this from just evidence of looking at the teeth and see if there's kind of a grind pattern. And sometimes when that's the case, sometimes a night guard can work and stop the grinding. But if the night guard is not working, your dentist can do that, or I think you can have an over-the-counter one made too. But if the guard's not working, then sometimes this masseter muscle here will be really locked up. The two main muscle groups for TMJ that we're going to talk about are the temporalis muscle and the masseter muscle. The temporalis comes up above in the head here, and the masseter is across the cheek and jaw. And the muscles on the inside that we're going to deal with are called the pterygoids. Okay? So, for instance, McKenna does have some TMJ issues here. And really, when we do these procedures, it's not so much of an alignment of the jaw as it is more stretching the soft tissues that support the mechanics of the jaw. Okay? The jaw is not in a joint that really needs to be adjusted that often, because aside from the shoulder, it's one of the most unstable joints in the body, just from the way it hinges and moves forward. Okay? There are times in certain cases where we have to manipulate the jaw to a degree just to get it to line back up with the teeth closed and they bite regularly. But those are few or far between, and usually they have come from some type of accident or trauma to the jaw or face. So in McKenna's case here, it's just standard TMJ pain from clenching, and you had some other things going like as a kid with your jaw, right?
Yeah, a little bit.
Okay, tell us a little bit about kind of what your symptoms were and what you went through with that, and then here recently your trip to the dentist there.
A lot of teeth grinding and a lot of clenching, and that's led to wearing out of my gums, which leads to poor tooth support. So they're worried about my teeth falling out and my jaw, just too much pressure on it to be able to support my teeth and my gums.
So right, so that's pretty big deal.
Yeah.
So the treatment option for that is to basically break the jaw and wire it shut for 6 weeks. It's not something she really wants to do right now. So if we can get a better alignment of the jaw, better mechanics with the muscles supporting the jaw and her closing and opening of the mouth, and increase the distance that her mouth opens and closes naturally, that will help improve mechanics of the jaw, and the teeth won't be coming down abnormally on one another, and this could help that condition without having the jaw broken and wired shut for 6 weeks. Okay, so we're giving this a shot first, and if this works, great. Then some other avenues she can go. If not, then in the meantime, it can help alleviate the pain while she's waiting to go a further procedure at a different specialist. Okay, so anyways, your typical TMJ patient is going to come in. Usually there's a lot of pain in the side of the face. It can even come up and give them a headache. It could be pain around the ear, pain in the side of the face and the jaw. It can even be in the back of the neck here into the SCM muscle and into the scalenes. It can be pain that comes around the base of the jaw, right around the corner there. So we're going to just do a few little things, and we start with gloves on because we're going to go inside her mouth and to the pterygoid muscles, and those are inside on the outside of the teeth, inside the jaw, and those will initiate a clench. So we're going to start with just gentle pinching of the pterygoids as she opens and closes the mouth. That's all that's happening. So you can't really see what my hands are doing, but to explain it, I'm going to grab the pterygoid muscle with my index finger, and then my thumb on the other side will just apply a little bit of opposing pressure there, and then we'll basically very gently squeeze that muscle group while she opens and closes, and that stretches and strips out that muscle so she has good opening and closing of the muscle, and there's no adhesions or knots within that group. And then we'll do some of the same things for both the masseter and the lower jaw here. Okay, so McKenna, we'll start with the left side here. Okay,
You might could come like over a little bit.
maybe Just
so you can see.
as long as it's still clear. Sometimes it gets a little blurry. Is that clear? Okay. So if you'll just open gently here. Now we're going to stay on the outside of the teeth here, and let's close down. Here we go. It's important to stay on the outside of the teeth so you don't initiate the gag reflex and less likelihood of getting your finger bit. So, all right. Now clench down. And when she clenches, I feel it grab my finger. The muscle clenches around my finger. So what I do when I feel that, I'm just going to apply some direct pressure on the outside here. Now McKenna, I want you to open the jaw gently and nice and slow all the way. There we go. And relax, close, and clench it just a little bit. Okay. And let's open it one more time. Very good. Now close. Good. And one more time. So we do roughly about 3 passes on the jaw here all the way. And close. Very good. Okay. And if she has some clenching or some pain in this other side, you can do both sides of the jaw. Okay. You can do that to just even it out. If there is a difference in how the jaw is open and closed, you'll feel that by palpating the jaw, and you'll feel which one opens least and last. Okay, and that's going to tell you if there's an alignment problem of the jaw that you have to correct first. And if that's the case, then we would correct the alignment of the jaw first, then work on the soft tissues around it. Okay. In McKenna's case, the alignment of the jaw was pretty good. I checked it last week. She just had this procedure done last week, right? And so we did a pretty good job on this last week. So we're just really kind of demonstrating kind of what we're doing this week on her, and just using some very light pressure because it's not very painful at all this week, and she's done better with it. So again, we'll just do that one more time. If you'll open gently, stay on the outside of the teeth. Now you close down. Okay, clench. There it is. Now open all the way. Very good. And you're just holding pressure. Close it. You're holding pressure on that pterygoid muscle as she's opening the jaw. And open. Very good. And as you start to stretch these, you'll notice that the jaw will start opening and closing a lot more. Okay? So let her get her bearings here. And now what we're going to do is we're going to put some direct pressure on the bottom teeth. Okay? And then we're going to have her open her jaw. And then we will carry the jaw down and take it down to it basically stops, and then she will bite against resistance there, and that just helps to increase the length of the clincher muscles in the masseter here. Okay, so open up, there we go, and bite down, but don't bite my thumbs off. Here we go. Relax. So as she relaxes, we just carry the jaw down a little bit. There we go. Now close. A little bit against resistance. Now relax it. See, it went open even further there, and this just slowly relaxes all the muscles in the jaw. Close down. And now gently relax that, and then it carries it to its next level. Good. Okay, so those are some of the releases we can do. Also, when we get to the masseter muscles, you're going to notice a lot of trigger points can develop in these masseter muscles of the jaw. The masseter is kind of a wider muscle group. This is your clencher. This is going to be really hard, tender, and painful, okay? You can have trigger points in here, and then as well as trigger points in the temporalis muscle. This also facilitates closing of the jaw and clenching of the teeth, okay? Now, if these muscle groups don't respond to manual stripping and stretching that we did, like we did that for her last week, then you can take dry needling to these muscle groups too. You just want to make sure you stay very shallow. You don't go too deep within the clencher here. You don't want to go through too much here, but you want to activate these muscle groups and see if you can, calm down some of the trigger points that they do develop here. And the dry needling of the temporalis and of the masseter muscle works really well. We'll usually couple that with some dry needling of the SCM muscle. So some muscles that facilitate the movement of the jaw and movement of the upper head and neck, okay? So what we do following the treatment from this, now there's several more things that we would do, but we'll kind of keep this short just really more as an informative for being able to treat this and to let you guys know how it's done. Once they go through the treatment, we'll then instruct the patient, obviously lay off of solid and hard foods for at least a week, softer foods, more of a liquid-based diet for about a week. And if it's severe, obviously they're going to add some ice packs to the jaw We use direct ice over a cloth here on the side of the jaw, softer foods, and then we recheck it. The most we usually have to do this particular procedure is, 2 to 3 times max. If it's not working within 2 to 3 times, then we don't continue that, and then we might suggest one of the specialists who we refer to if it's something that's out of our treatment league, and then we need to get to a different specialist. Okay. I hope that kind of answers a few questions about, and maybe get some understanding about TMJ and what you can do if you have TMJ problems, or TMD rather. I guess you should technically call it TMD, but if you have problems with your TMJ joints and you have temporomandibular disorder, we'd love a chance to talk with you, maybe help you with it. Thank you guys for joining.